going to present a pretty uncommon case. So this is so colorectal cancer is it's the third most common cancer and one of the leading cause of cancer-related deaths in the world. Usually, men are more affected than women. And regarding metastases, 25% of them present them on diagnosis. And the most common places to have metastasis of colon cancer is usually the liver, and brain is really it's really uncommon. So this is a case of a 62-year-old male that presented to the ER with a headache. He had a fall. I believe he was changing a light bulb or something, and then he fell down. He hit his back and had some head trauma. So at that point, he only had a little bit of lightheadedness. No, he didn't have any loss of consciousness, no nausea or vomiting afterwards, no visual or sensory changes. He does have a history of hypertension, CKD. He did have a hemorrhagic stroke before, and he had colon cancer, status post left hemicolectomy and surgery, had 12 cycles of Volfox chemotherapy, and all of this was diagnosed a year prior to this admission. So his blood pressure on admission was a little bit elevated. The rest of his vital signs were normal. So they saw on the CT brain, because of the head trauma, he had 1.7 times 1.5 centimeter hypodense mass with calcifications on the right external capsule with adjacent vasogenic edema. We can see it right here. Well, this is the MRI, but it was also in the CT. They did a CT also of his lumbar spine. He did have a compression fracture in the L2 vertebral body without retropulsion. So he was admitted for the brain mass, and well, he also had the fracture as well, right? So they did an MRI on him, and this is where they showed the lesion. So this it was a right lateral inferior deep frontal lobe and subinsular region with the enhancing mass surrounded with some edema. And some mild mass effect, and this was consistent with metastatic lesions. So he was evaluated by neurosurgery. They didn't do any acute surgery on him. However, he was evaluated by radio-oncology and on the oncology service, and he underwent stereotactic radiosurgery without any complications. So after this, the patient was going to follow up with a PET CT and follow up as an outpatient. So the interesting thing about this case is that having a colon cancer with brain metastasis is really rare. Usually it is in the most advanced stages of disease, and usually they have liver and lung metastasis. So just a little bit of a background, this guy also had liver metastasis before, like when he was already on the treatment. So the clinical presentation of brain metastasis can range from asymptomatic to seizure, focal neurological signs, which fortunately for the patient, he didn't have any of these symptoms, and actually the fall was more like a mechanical fall. He didn't feel dizzy or lightheaded before. So but we think that the fall was not related to the brain metastasis, but we're not sure about that. So the prognosis of colorectal cancer that is metastatic to brain is really poor. They have a median survival of 4 to 6 weeks if you don't treat them, and 6 to 9 months if they have active treatment. So usually the treatment is they do local treatment like the one that he received with the with local radiation. They can, depending on the axis or where's the location of the brain metastasis, they can do neurosurgical resection. They can also do whole brain radiation therapy if there are more lesions. So it pretty much depends on the disease, how is the patient's performance status with the ECOG scale, what's the location of the metastasis and the size. So, but the thing is that there's limited data on how to treat these patients optimally, especially because for colon cancer it's very rare. So as I mentioned, there are multiple treatment options. However, the data on the long term is really unknown. So there is no specific guidelines on this kind of metastasis for this cancer.